I will just give you a quick introduction. Dr. Gupta has 40 years of experience. He himself is an FMGE. He has done his DNB radio diagnosis in 2010. He has passed his fellowship in Royal College of Radiology Module 1. He's member of National Medical Science, member of Indian Radiological and Imaging Association, presently working as a consultant radiologist in Cygnus Group of Hospitals. He also runs private ultrasound and color Doppler clinics. So students, let us all quickly welcome, Dr. Sachin Gupta. Sir, so I understand you have, a very tight schedule. So I will be very quick. Initially, on behalf of students, I will be asking you a few questions for students to understand about your journey. And then, of course, we will pick up few questions from students, about the career of being a radiologist. So I hope, sir, you're ready and we can start the discussion, sir.
Yes, sir. Yes, I'm totally ready, sir. Thank you for introducing me, sir.
Thank you. Thank you very much, sir. Sir, the first very basic question, what was the motivation to, choose just an MBBS as a career? Why did you decide to join a medical school, sir?
So first thing first is like my father was a very known eye specialist. He was a doctor, and I've like grown up seeing him servicing the community. So that was my first motive to join the medical field, sir.
Absolutely. So basically, your motivation was your, father who
Yes, I have
himself was a
watched him all
physician.
my life. Yes, serving the community through his medical field. Just wanted to work like him.
Absolutely, absolutely. So then, why specifically the field of radiology? How that radiology and the fantasy or liking towards radiology as a field actually develops, sir?
So radiology was my second option. My father was an eye specialist, so I wanted to become an eye specialist, but couldn't. I wanted to join Shankar Netralaya in Chennai, but didn't get through the exam. So this was my second option. So I opted for it. I was always fascinated by the radiological department and all the machine equipment, so wanted to join it.
All right, all right. Sir, how about as a radiologist, what kind of daily routine responsibilities are there? And do you have emergencies, or is it a fixed duty? Do you work freelance, or you are attached to a hospital, or a student can start his own clinic? How does a setup work for a radiologist, sir?
Uh, Sir, if you are attached to a hospital, yes, you have to prepare yourself for the emergencies that can come anytime. Because once a patient lands up in the emergency department, you are the first person to be called up, and it's very common in the hospital setup. They have so many patients coming from roadside accidents and other emergencies. So yes, we have to be prepared up for emergency calls when you are attached to a hospital. But in private clinic, yes, you wind up the things according to yourself, and it's up to you. You want to work 24 hours, or you have to restrict yourself up to the normal clinical timings. That's up to you.
So this field provides that flexibility. So because certain fields there is no option, but in case of radiology there is a flexibility, right, sir?
Yes, yes, yes. There is flexibility when you have your own setup.
Sir, in terms of radiology is the field, my first question is, first of all, sir, do you directly interact with the patients, or how does it work? And if yes, then what are the memorable cases, sir?
Actually, there are so many like sub departments of your field. Matlab, you have an X-ray department, you have MRI department, and you have a CT department. And most of the radiologists, when they are working in such big institutes, they are mostly confined to they mostly sit in a ultrasound department, because that makes the bulk of your patient. And so you are in directly contact with those patients who are coming for ultrasound and color Doppler procedures. And else the other patients which are coming in MRI and CT and other X-rays, your technicians deals up. And if he finds him comfortable, he manages his own, or if he wants to ask something, he brings the patient to us. Then we
So
have to commute with the patient.
So do you have a direct, or as a radiologist, do you have a direction of, I mean, direct interaction with patients, or it is less? If it our percentage type, is it, 50%, 80%, 20%? How much of patient direct interaction is there, sir, in this field?
So almost 100% with the patients who are going for ultrasound and color Doppler procedures. and almost 80 to 90% to the patients who are going for MRI, CT scan, and X-ray. At least I make it sure that I commute the reports if they have something significant to the patient myself, not through a technician or somebody else.
So I next question definitely would be that, so in which means counseling is also important in your field, I mean, especially when you know something which is not too correct, which comes up in a report. So how important is counseling in your field, sir?
So counseling is very important. Matlab, it's right now in today's setup, it's really very difficult to convince a patient for the things. Patients are themselves very much primed up before coming to the department. They are all, matlab, they have all the information from the Google. Maybe it is right or wrong. So it's very important to counsel them first. You keep your knowledge side. Matlab, you have to believe on me what I'm saying to you. So counseling is very must.
Right. I understand the challenges thanks to Google. People have some preconceived notions. Sir, in terms of your work-life balance, are you able to balance, family and work? How does it work? Because in your field, if a student decides to consider radiology as a career, can he manage this work-life balance?
Yes, definitely he can balance. One can balance if you want to. If matlab, you have to set your priorities that that earning is not only the one thing you are made for. Matlab, for like you give a time, you restrict your time. The normal timings you consider make a timetable that I have to leave the department by this time. I have to finish my work by this time, and after that, my whole time will be for the family, except for the emergencies. So that is the way we can try to balance with our family and ourselves.
All right.
And my
Sir,
wife being
what
a
about
doctor
that?
also, she helps equally in this regard.
Right, sir. Sir, what about a demand of radiology as a career in India as well as abroad? Both the places. What do you think the demand?
Demand is huge, sir. Matlab, radiologists are deficient everywhere except for the top line cities. They are deficient in rural as well as in 3-tier cities. So demand is high, and in abroad also, but abroad setting abroad have some challenges uh, which are a little bit difficult to reach up there. And but yes, demand is there because you are the first one who will give the diagnosis what the patient is having. With the consultants, whether he is a physician or a surgeon, he cannot proceed further unless or until you guide them what actually the pathological process is happening in the body of the patient
All right,
over the
sir. In
disease.
fact, sir, right, sir. So one thing, students, if you have been attending this Moksh series, sir, we have got lots of specialists coming in. And last week we had one of the neurosurgeon coming in, and the same thing which you mentioned right now, that the top tier cities are saturated, but there is a lot of demand in 2-tier and 3-tier cities in India. So
Yes, and there is you cannot be ashamed yourself that if we are a doctor, we cannot settle in a second or 3-tier cities. I have worked at both places, and you get a very good recognition when you work in these cities. If people recognize you, they respect you very much. And in first-tier city, it's not like that. Only few people got to have those kind of respect in metros and first line cities.
so that's a very
Because
important
yes,
feedback. Yeah.
yeah, there's a saturation. No doubt, there's a saturation in metros.
All right, sir. In terms of radiology as a field, how much of research is important? Do the student have to be interested in research if they consider radiology? And what kind of research is happening currently in your field, sir?
The research, we actually in this field, the research is being done by the big companies like GE or Siemens or Toshiba. They have their bioengineering people who do the research work, and yes, they take the support of the radiologist in their work, and so you can be connected to research kind of thing. And yes, and this research thing is more in the abroad, in Europe and in America side, where you have a different research departments, and with the help of biomedical people, biomedical engineers, I want to say, and with their collaboration you can go into research work.
All right. So that is again a very important part. That this is one field where there is a lot of dependence on high-end machineries and technology.
Technology,
So
and
absolutely.
you have to collaborate with these people, biomedical engineers and other people. And yes, you were asking about the things going on, and you have recently mentioned about that. I was listening what were you saying. Artificial intelligence, this thing is like coming up very quickly in our setup. They're doing a huge amount of R&D in this artificial intelligence, and definitely this, it will help all the radiologists and other the consultants in the field.
Absolutely, absolutely, sir. Sir, majority of the students listening to you today, sir, उन्होंने नीट की 2020 की एग्जाम दी है and they will be joining a medical school very shortly. So,
Okay.
the point is that, why, if a young doctor who is aspiring doctor who is listening to you, why should he consider radiology? आप मतलब कोई 3 रीजन बताए कि ये फील्ड अच्छा है compared to other fields. What do you believe, sir?
सर मेरे को ऐसा लगता है कि मतलब ये when you are studying in your medical school in your undergraduate, you make your own perception ki where I want to go. You are posted in different departments for a particular period of time, and you feel like ki, हाँ, मतलब I want to do this thing. First of I think the main motivations come from there itself. मतलब some people will like to become a surgeon. मतलब आप कितना ही कुछ कर लो, वो उन्हें सर्जन बनना है तो उन्हें सर्जन बनना ही है. तो the main motivation comes during your undergraduate studies. मेन तो वहीं से ही आता है सर कि हाँ मुझे यही करना है.
Absolutely. So there is again, students, a similar thing we are echoing from all the specialists कि आप MBBS में dive करो, सारे अलग अलग internship में या rotations में experience करो departments and then take a decision. So yeah, you're
हाँ
right, sir.
हाँ आप किसी को कॉपी मत करो, किसी को देखो मत कि यार वो बंदा ऐसा है, वो ऐसा है, मेरे को वही करना है. यू विल मतलब यू मे अचीव व्हाट यू वांट, बट इट कैन समटाइम बी डिफिकल्ट, और बाद में हो सकता है आपको थोड़ा सा लगे कि यू हैव चूज द रॉन्ग डिपार्टमेंट.
वेरी ट्रू सर. सर, अगर कोई डेफिनेटली श्योर है कि रेडियोलॉजिस्ट ही करियर चूज करना है, आफ्टर मे बी लिसनिंग टू यू सर,
जी
तो
जी
व्हाट आर द सब्जेक्ट्स इन एमबीबीएस जो उनको अच्छे से पढ़ने चाहिए ताकि वो अच्छा
सर.
रेडियोलॉजिस्ट बने?
हाँ, एवरीथिंग एवरीथिंग बिकॉज लाइक आपको तो हर डिपार्टमेंट को कैटर करना है. गायनोकोलॉजिस्ट को, ऑब्स्टेट्रिशियन को, फिजिशियन को, ईएनटी पीपल, सर्जन्स. So everything, every anatomy, मतलब your anatomy should be very strong. Your every subject should be very strong. आपको हर चीज का मतलब आपको ऊपर से नीचे तक सब कुछ पता होना चाहिए. You should be well versed of everything. Because when you will study radiology, so you have to study each and every part. Gynecologist will study only about the pelvis, nothing else. Surgeon will about surgeon, yes, it's a vast thing. ENT people will do ENT thing, eye people will do eye thing. But when you are into radiology, you have to study each and everything. Each and everything. And plus, one more thing that is very, very difficult is physics. Physics is one of the
Okay.
main subject in radiology, and yes, आपको वो mug up करना ही पड़ता है. You cannot escape from that thing, and it's tough.
एब्सोल्युटली. सो स्टूडेंट्स, मेनी ऑफ यू जो पूछ रहे थे कि सर फिजिक्स का अभी मुझे क्या यूज होगा एमबीबीएस में, तो ये आपके लिए बहुत इंपॉर्टेंट है. इफ यू लव फिजिक्स देन डेफिनेटली हेल्प करेगा आपको अगर आप रेडियोलॉजिस्ट बनना चाहते हैं. और अगर फिजिक्स
हाँ.
थोड़ा पसंद कम था तो थोड़ा सा ये फील्ड से अवॉइड करिए. दैट्स व्हाट वी आर ट्राइंग टू काइंड ऑफ अंडरस्टैंड. राइट सर,
नहीं
राइट सर.
आपको मतलब इट विल बी फन इफ यू विल स्टडी अबाउट द फिजिक्स. मतलब आपको मजा आएगा. मतलब नथिंग टू वरी अबाउट, बट हाँ, इट्स एन एक्स्ट्रा सब्जेक्ट व्हिच मेडिकल पीपल वोंट बी प्रेफरिंग आफ्टर detachment of almost 5 years from the physics.
राइट सर, राइट सर, राइट सर. सर, ओवरऑल एज अ एमबीबीएस या अपने जो करियर के लिए एस्पायर कर रहे बच्चे, कुछ बच्चे इंडिया पढ़ेंगे, अब्रॉड पढ़ेंगे, व्हाट इज योर मैसेज? हाउ शुड दे कंसीडर देयर करियर अहेड, एंड फॉर देयर करियर व्हाट डू यू थिंक, a few things they should keep in mind, to be successful physicians irrespective of the field, sir?
So first of all, we are not practicing medicine because we want to earn a hefty amount of money. Money will come in your way. Be a good be a, I don't I'm not saying you become a ideal person or you, but to try to be as idealistic as you can, as the society wants you. Do the best what you can do for the patient, and the patient will come back for you. You will have a good amount of patience, and rest, um, if you have a good amount of patience with you, nothing to say about it. So you'll once you are famous, and one can become famous if he's idealistic. People love a consultant who is very idealistic, who don't want my patient to spend much. I think he can just like he can be treated uh, in a without spending much. So just be idealistic and don't go after money.
Absolutely.
Many
Again,
people
this is a yeah, yeah. You, sir.
मतलब most of us or मतलब many of us has this कि बस एक बार consultant बन गए तो यार अपने को we have to mint money, but no, this is not the thing. Just think about the patient. Money is a secondary thing, and definitely it will come. Money will come if you're famous.
एब्सोल्युटली सर, तो ये वापस ये भी पॉइंट इको हो रहा है। स्टूडेंट्स हमने पहले भी बहुत सब कंसल्टेंट एक ही बात कह रहे कि काबिल बन जाओ बस, मनी तो आ ही जाएगा, बट यू शुड बी ensuring that ethics के साथ काम करोगे तो by default
Ethics,
yeah,
बिल्कुल sir.
very true sir, very true sir. Sir, now we
Ethics
will
is
take up
must sir.
yeah. Sir, now of course we will take up a few questions from the student. I already have one question from Siddharth. So
Okay.
first question is, sir, what are the job prospects after MD radiology, and is
Okay.
independent practice available after radiology?
Siddharth, first of all, if you have completed MD radio diagnosis, I won't be saying directly jump into a private practice. I would suggest you to join some SR-ship, that is for 3 years, and or anything. You just pick up a subject that yes after MD radio, because for the tenure of 3 years when you're doing your MD radio diagnosis, everything will be superficial. You will be posted in MRI for 6 months, for in CT for 6 months, in conventional for 6 months, in ultrasound for 6 months, and last year of your MD radio diagnosis you'll be busy with your thesis work. So once you have passed it, join something, join a course, join some fellowship in MRI, or fellowship in CT, fellowship in abdominal imaging, or in anything else in like fetal medicine. There's so much, it's a very vast subject. You can go into intervention thing. That is also a very good upcoming branch if you want to settle yourself into first or second tier city. So don't jump straight away into private practice. I won't be suggesting you for that. And job prospects after SR-ship or after fellowship will be very high. And yes, you get a good salary also once you have all the experiences after your MD radio diagnosis. You'll start with a very, very good package.
All right, sir. Next question is from Dimple. She's asking, sir, will it make much difference in terms of the career and recognition if I am a DNB or a MD? Between DNB and MD, ऐसा कुछ ज़्यादा difference होगा कि still you can do a good career?
See, I am a DNB. Thing is, it's very, very tough to enter MD radio diagnosis, you know, as compared to DNB radio diagnosis. If you are getting, if you are getting MD radio diagnosis, nothing like that, because passing or the exit exams of MD radio diagnosis are not very tough. You can come out of it, but DNB, it's very, very tough. So if you're getting DMRD or MD radio diagnosis, you have to choose that before instead of DNB, because exit exams of DNB are really tough, really, really tough. I'm telling you, because we don't have internals. Because if all the examiners are external, nobody knows you. But it's not the similar in case of when you're a MD or your DMRD students, because one internal will be from your college, so he makes a very hell lot of difference. He can introduce, this guy has done a quite good amount. I mean, he can build up your impression over the externals, but it's not the same in case of DNB exam, which I have faced.
And sir,
So
her second part was, in terms of after, few years in a career, will it make difference? DNB ho ya MD ho,
no,
koi difference ho?
no. Once you have this, the Medical Council of India (MCI) also mentioned, and you can check the web also. They have now MD radio diagnosis and Diplomat National Board radio diagnosis. They are all on the same platform. प्रीवियसली क्या होता था कि आप एमडी रेडियो डायग्नोसिस के बाद सीधा एसआर शिप या कुछ मतलब असिस्टेंट प्रोफेसर लग सकते थे, लेकिन डीएनबी वालों को 1-2 साल की वो एसआर शिप करनी पड़ती थी। अब लेकिन अब गवर्नमेंट ने वो भी हटा दिया है, एज फार एज आई नो। आई हैव नॉट बीन इनटू एकेडमिक्स, बस यही
Yeah,
डिफरेंस
yeah.
था. बाकी DNB people, I can guarantee you, DNB people are very much more into like, मतलब DNB होते ही ऐसी इंस्टीट्यूट्स में है जहाँ पे रेडियोलॉजी का काम बहुत बहुत ज्यादा होता है. मतलब ऐसा कोई आप किसी भी इंस्टीट्यूट को DNB की डिग्री नहीं दे सकते हैं. So what you are seeing in a DNB institute will be much far better than what you'll see in MD radio diagnosis. क्योंकि सारे colleges MD radiology के MD उसके सारे अच्छे नहीं है. Few handful of colleges are good in. कई तो equipped भी नहीं है, आपको वहाँ पे CT scan नहीं मिलेगा, MRI खराब मिलेगा 6-7 महीने के लिए. But it's not so in DNB. Mostly private institutes होते हैं and वो वहाँ पे ये सब नहीं होता है. I think
जी सर absolutely sir. In
this will
fact,
help you.
absolutely sir. In fact, just to add Dimple, जब आप समझो रेडियोलॉजी के बाद यूएस में अगर फेलोशिप भी करना है तो भी एमडी और डीएनबी दोनों को अलाउड है यूएस में भी फेलोशिप के लिए. तो इट इज एट पार. तो
हाँ.
वो आप मत ज्यादा टेंशन लो.
आप जब दुबई में या यूएई में सऊदी में अप्लाई करेंगे तो DNB को थोड़ा सा एक अपर एज मिलता है, नो डाउट.
अच्छा सर, एक बहुत इंटरेस्टिंग क्वेश्चन है फ्रॉम अभिषेक भारद्वाज. इज आस्किंग, सर रेडियोलॉजिस्ट ओनली डील्स विद एक्सरे, एमआरआई, अल्ट्रासाउंड, और you also have to diagnose a person in emergency, as you said that radiology के लिए सारे subjects important है.
अब यस, आपको फ्रॉम टिप टू टो, मतलब आपको एवरीथिंग, यू हैव टू डायग्नोस एवरीथिंग फ्रॉम हेड अप टू द टो ऑफ योर लेग. मतलब यू हैव टू प्रिपेयर योरसेल्फ. इमरजेंसी में तो कहीं पे भी कुछ भी आ सकता है. एंड इट्स नॉट ओनली अबाउट MRI, एक्सरे, CTs, अल्ट्रासाउंड, कलर डॉपलर. इट्स मच मोर. मतलब नाउ थिंग्स आर कमिंग अप लाइक इंटरवेंशनल रेडियोलॉजी. वो अगर आप उस फील्ड को देखेंगे, इट्स वो एक अलग ही डिफरेंट सब्जेक्ट है पूरा पूरा. दैट यू हैव टू गो इनटू इंटरवेंशन. DSA अगर आपने सुना हो तो, DSA टेक्निक के बारे में, मतलब एक अलग ही लाइन है वो.
सर सैफ अली पूछ रहे हैं, सर रेडियोलॉजी और डायग्नोस्टिक रेडियोलॉजी ये अलग होता है कि सेम चीज है? सर
सेम है. इट्स वन एंड द सेम थिंग.
ऑलराइट. सर रेडिएशन ऑन्कोलॉजी और रेडियोलॉजी मतलब ये सारा सिमिलर है, मतलब कैसे रहता है वो?
नहीं, वो अलग है सर.
ओके.
दैट कम्स इन न्यूक्लियर मेडिसिन.
All right. Great. So students, any further questions quickly, because we have a deadline. So anybody else has anything to ask, feel free to type in, and sir will be happy to answer. But otherwise, sir, thank you very much, because I understand आपका schedule था, but you're part of this session and you could contribute your experience to the students. So happy to
No,
have
sir.
you
Thank
on
you
the
so
platform.
much. I'm really sorry. I was technically restricted today. I had some problem with my things. I'm really sorry for that. And best wishes to all the students who are listening the webinar. Best wishes from my side. Best of luck.
Sure. Thank you very much.
Thank you,
Sir,
sir. Thank you, sir. Thanks.
all right.
Nice
Thank
talking.
you very much, students. Thank you, everyone. And now I'll end this session. Thank you, everyone. Thank you.